So our final speaker is Dr. Kristine Lakhan. She is a neuropsychologist with the Brain Health and Research Institute here in Seattle. She has a background in clinical research, medical neuropsychology, and holistic wellness. Previously, Dr. Lakhan was the director of the Rehabilitation Neuropsychology Service for the VA Medical Center in Birmingham, Alabama, and a clinical assistant professor at the University of Alabama at Birmingham. So Dr. Lakhan is going to provide us with tips to help everyone achieve optimal brain health, both in terms of treating the disease and maximizing potential, incorporating tailored lifestyle interventions. She will discuss effective strategies for preventing and treating cognitive decline. And Dr. Lakhan actually just moved to Seattle about 2 or 3 months ago from Birmingham. So she's new to the city, but enjoying it. Please join me in welcoming Dr. Lakhan. Sure. Thanks so much. You're welcome.
Okay, great. All right. I am so thrilled to be here. This is my debut in Seattle, in this beautiful city, and I actually haven't been here for 2 to 3 months. I've been here just at 7 weeks. We moved, cross-country move, family in tow. We also had a dog escape in the Denver airport, so that might actually have gone viral on YouTube. So lots of circus activities on my move over, but I'm so thrilled to be in Seattle. And in a moment, you'll see why, and also just excited to talk with you guys today with Alzheimer's Foundation of America. I'm a big fan of all of that they do. And in addition to what I was doing at the VA in Birmingham, Alabama, and also as a clinical professor at UAB, I also opened my own precision brain health clinic. It was more of a micro practice, so we started out a half day a week. It quickly grew to 1 day, then 2 days, then 3 days a week, where we were providing these types of multimodal approaches. And so this is kind of the dream that I have in terms of giving more hope to Alzheimer's disease. And as a part of that, Alzheimer's Foundation of America provided us with a seed grant to do a brain health class there. So I'm just a big fan of the work that they do and the education that they do, and happy to be here. So today, I'm going to have the pleasure of talking with you guys about the root cause approach to brain health. And I think this is great because I'm kind of taking the baton from where Dr. Berwick left off. And so in talking about a little bit more about how these lifestyle changes can really make a difference in terms of preventing disease, stabilizing disease, and in some cases even restoring cognitive function. So my cross-country trek was to take the precision brain health to a broader level. And so I joined Dr. Mary Kay Ross in opening the Brain Health and Research Institute. We're right here in Seattle. We're located at 200 West Mercer Street. Back there we have a table where Stephen Ross, our COO, and Dr. Jeremy Whiting, our other physician, are back there. And if you have any questions, you can ask them about it. Our team members, it's a team approach. Dr. Mary Kay Ross, who's a functional medicine provider. I'm a neuropsychologist. Dr. Whiting is also a functional medicine provider. And then Carrie Mills, who's a caregiver support person, really a fabulous person, and kind of provides the glue of the program. And then Stephen Ross is our COO. We're also getting a dietitian on staff and also an exercise physiologist. So we can really approach this through a team approach. The thing that really impressed me about what we could do out here with the Brain Health and Research Institute is that we're in partnership with the Institute of Systems Biology. The founder of the Institute of Systems Biology is Leroy Hood. He's a genomic scientist. And in question, I think someone had a question earlier about what we read all this on the internet, what can we believe, what is true, it all sounds good. Well, in partnership with the Institute of Systems Biology, that is exactly what we're going to be able to do. We're going to test out these theories to see what really works and why it works, and we're able to sift through all this information and provide you with the cutting-edge clinical and scientific information so that we can move forward and really change the trajectory of this disease. And so the partnership between Institute of Systems Biology and the Brain Health and Research Institute is really providing a nexus between scientific innovation and cutting-edge clinical practice. So we're located right here in this beautiful city, right downtown, and my family and I ended up on Mercer Island, and it's gorgeous. And every day I'm just like pinching myself as I travel over 90 West to go to Queen Anne, and it is just so picturesque. And don't get me wrong, I loved Birmingham, Alabama. It was a very difficult decision moving here, but it is just wondrous to behold like the beauty that you have here, and we get to look out today as well. Just a disclaimer before I get started, I just want to make sure that everyone knows that everything I'm providing here today is just for educational purposes only. I want to reiterate that I'm a neuropsychologist, a PhD, not an MD. I'm not a dietitian. Most of the things that I'm mentioning are solidly supported by research. I wouldn't recommend anything that wasn't, but before doing anything in terms of lifestyle changes or adding supplements or anything like that, definitely check with your doctors. Some things as benign as reducing sugar from your diet, which is something very, very important in terms of Alzheimer's prevention and in stabilization of it, can have pretty devastating effects for someone who has diabetes and is on insulin. And so even before changing something like that, be sure to check with your healthcare provider. So our mission at the Brain Health and Research Institute is to prevent, stabilize, and restore cognitive function. My personal passion is more in terms of the prevention aspect of it, but we also see patients who have early stages of memory issues, who have slipped into a mild cognitive impairment, and also those with early Alzheimer's and even later stages of Alzheimer's disease, because we can really provide supports in terms of stabilizing the disease and also helping caregivers with the support that they need to deal with all the other issues that go along with it. Our mission is really to transform fear and resignation into empowerment and hope, and I think that's something that has been missing from this conversation for a very long time. So let's get started. All right, so my objectives today are to quickly discuss, I think I'm almost out of time, quickly discuss 3 questions in terms of dementia. And the first one is, what is it? And actually, we have been pretty good about that. And I think Dr. Burnick talked a lot about how we diagnose what it is and being able to differentially diagnose. And we've also answered a second what question of what to do about it: give a medication. However, we've found that those medications are not very efficacious. At best, they're giving about 6 to 9 months. And we found also from a meta-analysis that was published in November of 2018 that in some cases the medications can actually make the disease progress faster. So I think it just really depends on the individual, and so I think there's more to the story. And so the second thing is to ask, which is really more 21st century medicine, is why is it? So we need to know what it is, but then we ask why. We ask what are the underlying root cause drivers of the disease? And then we discuss how. How can we approach a comprehensive treatment where we can get at those underlying drivers and at some point make a shift in terms of the progression of the disease, and in earlier cases, maybe even restore some cognitive function, and hopefully prevent if we get early enough. So I'm going to start out with the what. Again, we're very good at that. As a neuropsychologist, that is the thing that I do. I'm very, very good at differentially diagnosing. And the focus is really on the diagnosis. And as Dr. Burnick referred to, that memory problems can come from a variety of different sources, and dementia can mean a lot of different things. So we do need to know what it is, what is going on before we begin any type of treatment, but it's really more of a starting point. And so dementia is often used interchangeably with Alzheimer's disease. However, Alzheimer's is a type of dementia. They all kind of fall under this umbrella. Alzheimer's usually takes up about 2/3 of that umbrella, but then there's also different types of dementia, such as Lewy body dementia, which also has some Parkinsonian features and often accompanied by psychiatric symptoms like hallucinations, or a frontal temporal dementia where there's more behavioral changes. But then there are other things that are actually very treatable and reversible, such as a B12 deficiency, or some cases it could be depression or anxiety that's a differential. And then if you address those issues, the memory problems can really improve or get back to baseline. And so it's really important to find out what type of dementia it is, or if it is in fact a dementia. The gold standard for a dementia evaluation is to have a detailed medical and neurobehavioral history, to do a physical and neurological examination, to have comprehensive laboratory tests, to do brain scans such as the CT, the MRI, and the PET scans that Dr. Bernick talked about, and a neuropsychological evaluation. Most of the time, patients go to their primary care physician and may or may not have all aspects of this in terms of diagnosing. And so if you or a loved one is concerned about dementia, be sure that they are getting the gold standard in dementia evaluation, not just a conversation of whether or not they have memory problems, not just a memory screen. And as I'll talk about in the next two case examples, that it can go either way. One, it's not identified when it needs to be identified, or two, it's misdiagnosed as a dementia when it's really something else. And so if your loved one or yourself is really concerned about a dementia, at least make sure 3 or more of those things are done during the comprehensive evaluation. And if it wasn't, then maybe you need to go to a specialist or get a second opinion. It's really important that you have good information and get the earliest care that you can. I hope so. I can. You got it? Okay. And I also, if you guys want to put your name back there, there's a, on the Brain Health and Research Institute table, if you want me to send slides. I don't know if they made the packet or not, and that's due to my delay. Did you guys get the slides? Okay, so that if you want a copy, just put your name and email back there, and I'm happy to send you a copy. And so case example, so at my Precision Brain Clinic in Birmingham, Alabama, we had a 64-year-old Caucasian woman come in, and she was just a breath of fresh air. She was an actress, but she was really concerned because she had been really great in her profession, but she had a part and she kept forgetting her lines. She was having great difficulty and was really concerned that she was starting to develop Alzheimer's disease. She had a very strong family history of Alzheimer's disease, and she was just, devastated by that and really pretty concerned that this was the start of it. She also had gone to a provider that was not necessarily well versed in neurodegenerative disorders, who gave her a cognitive screen, and she did not do well on the cognitive screen, and he did diagnose her with early Alzheimer's disease based on her complaints without doing a full evaluation. We did a comprehensive evaluation. As a part of our evaluation, we often offer genetic testing along with interpreting those genetic tests with your physician and with a psychologist. And we offered that for her, and we found out that she was actually ApoE3E3, which means that she doesn't have the Alzheimer's disease, which, as I'll get into in just a little bit, doesn't mean that you're not off the hook for Alzheimer's disease, but you're not necessarily at a higher risk. So she was pretty relieved at that. And then I did a comprehensive neuropsychological evaluation with her. All her cognitive test scores were actually well above average, in the superior range, except for processing speed. And with processing speed, we know that when someone has issues with depression and anxiety, processing speed can sometimes slow down. And so, or it can be kind of an early marker of some different nutritional deficiencies, things like that. And I'm wondering if that's why she didn't do well on the cognitive screener, just because it was more of a computerized test and she couldn't do it quickly enough. After we did all of our comprehensive lab work and our comprehensive evaluation, she was diagnosed with depression and anxiety, not Alzheimer's disease. I don't even think she was at high risk for Alzheimer's disease. She spent a year doing therapy, cognitive behavioral psychotherapy with our behaviorist at the Brain Health and Research Institute. Her depression improved, her anxiety improved, and pretty gratified, I went to see her as the star of a show in a local theater production. She was amazing. She stole the show. She was hilarious. My daughter went with me, and my daughter's 9, and she enjoyed it as much as I did. So I think, case in point, you really want to have a thorough evaluation. I think she was ready to hang everything up and think that she was going to continue to decline. Another example was a 64-year-old Caucasian woman who had 16 years of education. She was actually still working as an administrative secretary when I saw her. And this was pretty concerning. Her family was really starting to get concerned about her memory. She had started to ask the same things over and over again. She also had forgotten some of the grandchildren's birthdays, and she was really the matriarch of the family, and that was really, really unusual for her. And then the thing that really brought them in was that she had been driving her granddaughter to ballet practice for the last 3 years. And she was driving her, she got to the stoplight and asked the 9-year-old granddaughter which way she should turn. And the 9-year-old thought that she was kidding. And then when the 9-year-old found out that she was not kidding, she really didn't know where to go, the 9-year-old was concerned, told her parents, and that's when they brought her in for an evaluation to the memory disorders clinic at a major medical university. She was given a screener where she scored a 30 out of 30 on it, and they told her that it was anxiety. They followed her for 2 years, and the symptoms continued to worsen. And then the family finally insisted that she come for a neuropsych evaluation. And they actually came to our brain health clinic, so we did much more than a neuropsych evaluation. We also did detailed laboratory testing and also followed up with FDG PET and an MRI. And we found that she had 2 copies of the ApoE4 allele, which puts you at a pretty high risk. Actually, in some cases, it can be upwards of 90% higher risk for developing Alzheimer's disease. And she rapidly declined prior to that point. We were able to stabilize, but it just is so frustrating that she didn't get care before, and the family knew and she knew. And I think that just demanding a full evaluation is really an important thing for you and your loved ones. So that gets us to the next question. So we know what it is. It's Alzheimer's or it's depression, so we kind of have a starting point of where to go from here. But what we really want to know is, why is it? And I think that's where we're going now with 21st century medicine. We want to get to what is the root cause of the issues. And we use a systems biology approach to discovering the underlying drivers of the disease. Now, the important thing to note is that it's not necessarily the same thing that's driving memory impairment for everyone. And it can be different for everyone. It can be based on genetics, on biomarkers, environment, and lifestyle things. And so we want to figure out the why and figure out why it is tailored to that individual. And so we use kind of what's called a root cause analysis. And root cause analysis comes from total quality management, from more of the managerial skills, where in a company you want to get to the root cause in order to benefit the company. And so we use that same framework in terms of how we do medicine. And so typically in conventional medicine, we see the symptom and we use a medication and treat that symptom. But that symptom continue, we have to keep upping the medication because we don't really go down to the root cause. And the root cause can, have the first level cause, the second level cause, and the root cause. So for example, if someone has memory problems or Alzheimer's as the noticeable problem, the first level cause might be buildup of amyloid plaque. And so our medications are getting at that first cause. We're trying to clear that amyloid plaque, but we're not going back and seeing what's causing the buildup of that amyloid plaque. That second level cause might be that this person hasn't slept well in the past 30 years, and they can't clear that amyloid plaque during their sleep. And so why wouldn't we start to treat their sleep issues so that they can start to clear out the amyloid plaque? But then we find that why is that plaque accumulating so fast in the first place? And maybe there's something else to the story. Maybe there's a toxin or a biotoxin, like Dr. Burnick said, that's kind of the next thing in terms of research, that's building up and causing the amyloid plaque to accumulate faster in that individual, and then they're not sleeping, so it's not clearing as fast. And so the medication is just really getting at that first level cause. And so maybe that's why the medications have been less than efficacious for Alzheimer's disease. And so I love this picture. As medical providers, we offer pills and medications to kind of mop up, but we forget to look what's making the faucet overflow. We forget to look at why the water is just running out like that. And so we never can quite get to the bottom of it, and the disease process continues to get worse. So the root cause contributors can be different for everyone. There can be a genetic component, and Dr. Burnick touched on that. There are familial forms of Alzheimer's disease, but that really accounts for less than 10%. In some research studies, it's been less than 5%. So the familial variants, there is a very high probability that that family will have it running in their family, but there's so few that are affected by that. Now, the other genetic marker is the genetic risk, which is the ApoE allele. However, I've seen patients with the E2, so you get one copy from each parent, and it can be a E2, E3, or E4, so there's kind of 6 variants altogether. And the E4, if you got a copy of E4 from each parent, it puts you at a higher likelihood, and you should pick your parents better the next time. And then if you get E4, E3, it's about a 60% higher likelihood. And then if you have E3, E3, then you're kind of negligible, not necessarily more or less. And E2, E2 is actually supposed to provide a protective effect for Alzheimer's disease, and it's actually pretty rare. However, I have seen ApoE4, patients that are well into their 70s and do not have signs of Alzheimer's disease. I have also seen a couple of E2 patients that have been ravaged by Alzheimer's disease early on. So there's more to the story than just genetics. And then we look at biomarkers, and biomarkers can be many different things, like the radiology tests like MRI, CT can show biomarkers of a disease. But what we look at in our clinic as well is really detailed laboratory biomarkers, blood biomarkers. And those can be different for everyone. It can range from looking at a D3 level, which we know vitamin D3, which is actually a hormone, can affect many, many functions, memory including one of them. Or we can look at things like B12 or cholesterol, like all those different markers, HbA1c, which is an insulin marker, and see if any of those are contributing to the picture. We also look at environmental factors, and we also look at lifestyle factors. And I'm very cognizant of time. I think my time is up. And so I think I might just stop here. But I could talk about this till the cows come home. So if any of you have any more questions, please do, go visit us at the back of the table or come up and ask questions, and I'm happy to answer any right now. Okay. Oh, yeah.
When you do a neuropsych evaluation, do you usually meet with the patient again to tell them the results?
Absolutely, absolutely. And I think I'll repeat the question for her. She asked when go ahead.
When you have a neuropsych evaluation, do you meet with the patient again to discuss the results?
Yes, and so different neuropsychologists and different clinics do it different ways. I think the old school way used to be is that the neuropsychologist was just a referral source. They went and did some esoteric thing, in a closet with the patient, and then they had this mysterious report that would show up with the physician, and the physician would give the results or might not incorporate the results. It's very different now. I think that 21st century neuropsychology, we are able to really do detailed neuropsych testing, not in 8 hours. I can do great neuropsych testing in an hour and a half with targeted tests. And then I always, always, always give feedback. I think that it's important for patients to understand what that means, and I think it's important to discuss treatment options. We've gone a step farther at our clinic here in Queen Anne. I'm so thrilled about. We actually have a team meeting with the patient at the end where everyone is there, the physician, the neuropsychologist, myself, our caregiver support, so we can really put together a full treatment plan. And I really think that's kind of how dementia and memory problems and cognitive issues should be addressed, with really a full look at that.
We've had a neuropsych eval, and apparently the results were given to the neurologist, and we never met with the neuropsych again, which I found kind of unsettling.
Did you follow up with that person, the neuropsychologist, or?
No. Well, we could look online to myvirginiamation.org, and the only way we found out anything about it was you go to the summary that they had written, but we never saw her again.
Yeah, that's unfortunate. And like I said, different clinics and different hospital settings, different neuropsychologists do it different ways. But I think that patients are entitled to get the feedback.
How much is covered by Medicare of what you do?
Right, that's the big question. And I think on the tail end of the talk about assisted living, and so I think, do you want to invest upfront and support and prevent, or downstream? And so what we're doing now is pretty cutting edge, and it's not covered by Medicare. It's not covered by health insurance. We do our best to have the laboratory work covered by insurance, but the clinical care is not. It's just takes about 17 years for the research, the cutting edge research, to get into clinical practice, and takes about that long for Medicare or health insurance companies to cover that type of care. And so what we do is really not covered by health insurance.
I have a question regarding people are talking about the things that are accumulating in our brains, or our potential future Alzheimer brains, as far as my family. And I'm wondering, what are things we can do, or what are some of the natural things, because I believe in natural medicine.
Yeah.
I think you should always have a physician and a naturopath if possible.
Absolutely.
Sometimes medical insurers don't cover that, and some do. and it's important to pick your health care. But also, as far as how can we cleanse our brains? I mean, I know so many diseases are related to GI tract, and I'm a veteran. I have several people in our family that served military, different levels and whatever, that have it, and also farmers, and they all grew up on a farm, and they all have different lifestyles that are now doing it. So how do we get rid of these toxins, both from the physical aspect naturally and cleanse our brains as well as our bodies? What do you suggest?
Yeah, and actually let me just skip ahead. I'm very cognizant of your time. If anyone needs to get up and go, you will not hurt my feelings. I realize that this is supposed to only go till 12:30. But let me skip ahead in terms of the slides here. And I know there was a lot more I was going to cover. Oh, this is a good one. You guys thought I was too young to remember Paul Harvey, right? I remember him well. I love Paul Harvey. And I think on the tail end of your question, I think one of the things that we're not thinking about is the toxins and how they contribute to the development of amyloid plaque. And one theory is that if someone has toxins or exposure to toxins, whether that be heavy metals, like lead or mercury, or mycotoxins such as molds, pesticides, insecticides, health and beauty aids. If you think about how benign it is to rub a lotion on your body, but those lotions that are not policed by the FDA, we haven't had a law written to protect us from chemicals in our health and beauty aids since 1938. And the UK bans over 1,400 ingredients from their health and beauty aids. We ban 30 here in the US. So if you get some cheap lotion, from Walmart that you're thinking it's fine, and you put it on your skin chronically, daily, it takes 26 seconds for that to get into your skin and into your bloodstream. And so those toxins can affect you as well. Air pollution, industrial chemicals. So I think, that is a contributor to one of the root causes of the development of amyloid plaques. And so one thing that you can do is to clean up your world in some ways. There are so many now natural health and beauty aids, although the word natural has no meaning. But if you look on the Environmental Working Group, they have a Skin Deep app and a Skin Deep database where you can look up a product and see how it rates in terms of a 0 to I think it goes up to 10, and 10 being like a higher level of toxins, and 0, I would say 0 to 3, then that seems like that would be a lower level. So that's one way to really reduce it, is reduce your exposure. Making sure that your air quality is good, making sure that you're not exposed to mold in your home, making sure that you're not exposed to heavy metals or haven't had exposure to heavy metals. And then eating clean food. Organic is important, organic is expensive, and so again you can follow the Environmental Working Group Dirty Dozen and Clean 15 app. The Dirty Dozen are the 12 worst offenders in terms of high levels of pesticides. Strawberries are one of them because you just can't wash it off. And my daughter loves strawberries, and so we only buy strawberries when they're local, organic, and if they're, $10.99 for a little thing of strawberries, we just skip the strawberries that week, and then it's more of a treat. But you don't have to buy everything organic, and if you're watching your budget, then follow the Dirty Dozen with that. So those are a few ways.
We have time for one more question.
Okay. And sleep is the other way. It cleans out the amyloid.
So with the family history of dementia, Alzheimer's, you said it was really rare, but isn't it, because a lot of people in their 80s, isn't the early onset much higher percentage with family related?
It is starting to be, it's starting to be a little bit in terms of earlier onset, and that might be a concept that I was going to introduce where genetics and epigenetics. So genetics is your genetic risk, and epigenetics is how those genes play out in terms of what happens to you during your life. So say you do have a risk for Alzheimer's based on like the ApoE4 allele, then if you've had many events in your life that put you at a higher risk, it might start to show up a little bit earlier in your life. Say that you were exposed to a lot of chemicals or toxins, say that you've had head traumas or lots of stress in your life, it might actually show up a little bit earlier than that. Did that answer your question? All right.
Kristine,
Yes.
thank you so much.
Yeah,
Ladies and
you're
gentlemen,
welcome.
let's hear it for
Thank
Kristine. Just be careful. Okay?
you. Okay, thanks.
If anybody would like any of the information here, any of the PowerPoint presentations, Kristine will be here. She's in the back to my left. David is still here, and Dr. Bernick's team is still here as well. Just see them. Or you can email me at info@alzfdn.org. You know, we talked about information before in clinical trials. Our website has all of it on. So if you go to alzfdn.org, it's the abbreviation of Alzheimer's Foundation. .org, you'll find a load of information. You could also take an online memory screening test on our website as well. It's very simple. It's just a few minutes in the privacy of your own home. Nobody's going to know how you scored, and I'm sure you're going to score extremely well. And she went, woo! I just want to say thank you so much for attending. We really appreciate the attendance. I hope you enjoyed Dr. Bernick, Kristine, and David, our guest speakers. Thank you so much, ladies and gentlemen.